The first muscle that I'm going to start out with is the trapezius muscle. The superior fibers elevate and superiorly rotate the scapula. The middle fibers retract the scapula, and the inferior fibers depress the scapula. The concentric movement of the trapezius is shoulder elevation, and the eccentric movement is shoulder depression. The name of the joint involved is the shoulder joint. The bones involved are the occipital bone, the thoracic vertebrae, and the spine of the scapula. The origin of the trapezius is the superior nuchal line of the occipital bone, the spine of the the ligamentum nuchae, and the spinous processes C7 to T12. The insertion of the trapezius is the clavicle at the acromion processes in the spine of the scapula. The next muscle I'm going to talk about is the biceps brachii. The biceps brachii supinates the forearm and flexes the forearm. The concentric movement is flexion of the elbow, and the eccentric movement is extension of the elbow. The name of the joint is the elbow, which is a synovial joint. The bones included are the humerus, the radius, and the ulna. The origin is the supraglenoid tubercle of the scapula, the short head of the coracoid process of the scapula. And the insertion is the radial tuberosity and the bicipital aponeurosis. The third muscle I'm going to be talking about is the triceps brachii. The triceps brachii is the primary extensor of the forearm. The long head of the triceps extends and adducts the arm. The concentric movement of the triceps brachii is elbow extension, and the eccentric movement is elbow flexion. The name of the joint involved is the elbow joint, which is the synovial joint. The bones involved are the humerus, the radius, and the ulna. The origins of the triceps brachii are at the infraglenoid tubercle of the scapula for the long head of the triceps brachii, the posterior humerus above the radial groove for the lateral head, and for the short head, it's at the posterior humerus below the radial groove. And the insertion is at the olecranon of the ulna. Right. The fourth muscle I'm going to be talking about is the latissimus dorsi. The latissimus dorsi is the agonist of arm extension. It also adducts the arm and medially rotates the arm. The concentric movement of the latissimus dorsi is arm adduction, and the eccentric movement is arm extension. The name of the joint involved with the latissimus dorsi is the scapulothoracic joint, and the bones involved are the spine and the humerus. The origin of the latissimus dorsi is at the spinous processes of T7 to T12, the ribs 8 through 12, and the iliac crest, and also the thoracolumbar fascia. The insertion is at the intertubercular groove of the humerus. The next muscle is the gastrocnemius. The main movements of the gastrocnemius are leg flexion and plantar flexion. The concentric movement is flexion of the leg, and the eccentric movement is extension of the leg. The joints involved are the knee and the heel, and the bones involved are the femur and the patella. The origin of the gastrocnemius is the superior and posterior surfaces of the lateral and medial condyles of the femur, and the insertion is the calcaneus of the heel. The next muscle is the extensor digitorum longus. The main movement of the extensor digitorum longus is extension of toes 2 through 5, and it also dorsiflexes the foot. The concentric movement of this muscle extends the toes and dorsiflexes the foot. The eccentric movement flexes the toes. The name of the joint involved is the ankle, and the bones involved are the tibia and the fibula. The origin is the lateral condyle of the tibia and the anterior surface of the fibula, and also the interosseous membrane. The insertion is the distal phalanges of toes 2 through 5. The next muscle is the flexor carpi radialis. The main movements of this muscle are wrist flexion and abduction of the hand. The concentric movements are flexion of the wrist and abduction of the hand, and also assists with elbow flexion. The eccentric movements are wrist extension and adduction of the hand and elbow extension. The name of the joint involved is the wrist. The bones involved are the humerus and metacarpals 2 and 3. The origin of this muscle is at the medial epicondyle of the humerus, and the insertion is at the base of metacarpals 2 and 3. Next muscle is the palmaris longus. The main movement of this muscle is weak wrist flexion or drop wrist. The concentric movement of this muscle is tension of the palmar aponeurosis, wrist flexion, and elbow flexion as well. The eccentric movement is extension of the elbow and extension of the wrist. The name of the joint involved with this muscle is the wrist. The bones involved are the humerus, and it also attaches to a muscle or a tendon, but it varies in everyone because some people may not have the palmaris longus. The origin is at the medial epicondyle of the humerus, and the insertion is at the flexor retinaculum and palmar aponeurosis. The next muscle is the tibialis anterior. The main movements of this muscle are dorsiflexion of the foot and inversion of the foot. The concentric movement is dorsiflexion of the foot, and the eccentric movement is inversion of the foot. The name of the joint involved with this muscle is the ankle, and the bones involved are the tibia, the first metatarsal, the first cuneiform bone in the foot, and the origin is the lateral condyle and proximal shaft of the tibia and the interosseous membrane. The insertion is metatarsal 1 and the first or medial cuneiform. The next muscle is the deltoid. The main movements of the deltoid are, with the anterior fibers, it flexes and medially rotates the arm. With the middle fibers, those are the prime mover of arm abduction, and the posterior fibers extend and laterally rotate the arm. The concentric movement of the deltoid is flexion and rotation of the arm, and the eccentric movement is extension of the arm. The joint involved is the shoulder. The bones involved are the clavicle, the scapula, and the humerus. The origin is the acromial end of the clavicle and the acromion and spine of the scapula, and the insertion is at the deltoid tuberosity of the humerus. The last muscle I'll be doing is the masseter muscle. The main movements of the masseter are elevation and protraction of the mandible, and it's the prime mover of mandible elevation. The concentric movement of the masseter is elevation of the mandible, or closing your mouth, and the eccentric movement is protraction of the mandible, opening your mouth. The name of the joint involved with the masseter is the temporomandibular joint, or the TMJ. The bones involved are the zygomatic bone and the mandible. The origin of the masseter is the zygomatic arch, and the insertion is the coronoid process of the mandible and the lateral surface and angle of the mandible.